Hi, welcome to my channel. Thank you for joining me, Dr. Erica here. I am talking about the latest news on the Reverend Jesse Jackson, the renowned civil rights leader who led the fight in the African American community in the 1960s up until his last day on the earth. He was a fighter. He walked along Dr. Martin Luther King Jr., he walked along all of the civil rights leaders who came after Dr. King to help the Black community. He did so much outreach services, and his diagnosis is supranuclear palsy, or a subset of Parkinson's disease. I recently learned. Also, Muhammad Ali, or Cassius Clay, previously called, now Muhammad Ali, he before death was diagnosed with the Parkinson's disease as well. He did not progress to a more serious condition, but we do know that both these two African American men were diagnosed with Parkinson's disease. So I thought that I should just review my notes, go over some of the medications that are centrally core medications for treatment of Parkinson's disease. Parkinson's disease is not curable at the moment. However, it is a well-known disease and it can be managed, whereas the progression can be slowed with the medications that are being used on a regular basis. People can have a normal life and continue on with life. However, the outcome of the medication, the purpose of taking the medication is to produce a well-rounded quality of life for the individual. So I wanted to just talk about Parkinson's disease and mention some of the medications like levodopa, carbidopa, or Sinemet. There are also newer names that are on the market that have been FDA approved with these two active ingredients. Levodopa, carbidopa. It's readily absorbed once taken. Usually it's going to be taken 2 to 3 times a day, and it should be tapered off if the patient is going to be changed to another medication. Also, it's again readily absorbed, so that's not an issue when taking with other medication. It acts just like the biology of the dopamine element that we naturally produce as humans. Dopamine is a neurotransmitter that helps with euphoria, it helps with cognitive ability, it helps with skill, mobility as well, and it's centrally located in the brain. So what carbidopa levodopa usually does is act as a mimetic. The levodopa portion is going to mimic dopamine, and it's going to enhance or replace the dopamine that would naturally be there. Carbidopa is a substrate that helps to reduce the chances of levodopa failure. The component carbidopa is going to help facilitate levodopa being a 100% active and effective safety, as well as safety, working medication in the cerebral. So I want to just make mention of that core important drug for those students out there, for those pharmacy students, pharmacy technicians who need a brief update about the medication for Parkinson's disease. Now, the Reverend Jesse Jackson was more than likely taking this medication to some degree, whether it was twice a day or he was taking a newer approved brand name for the medication, because it has been on the market for quite a while. And in the recent years, again, other manufacturers have producing the same ingredient under a different brand name. So I'm sure he's been getting the best quality of care up to the end of his life on this one core medication. There are also other medications that act like dopamine as well, but they don't act as well as the Sinemet or carbidopa levodopa, but they are still effective and FDA approved. Not to downcast them at all, but we do want to make sure The other medications that we should understand is going to be the ropinirole and also the pramipexole. These medications are very important. They are used in Parkinson's disease management along with the Sinemet. They are used as secondary or tertiary regimens. I put a number two and a number three on those, with number one being Cinemet. So I want to just make mention that they are also readily absorbed about an hour, 2 hours after taking the medication. You will start to see them working. You will start to see them being effectively absorbed on a micro level, and then the half life allows it to start working, and it must be dosed 2 to 3 times a day for those medications as well throughout the day. And once they are thought to be not needed or discontinued, then they should be tapered off within a certain time frame for safety. Those medications, again, are secondary or tertiary, with Cinemet being the primary. So I hope all of this information has helped you. Some side effects are going to be like dry mouth, irritability, shakiness, insomnia, all of those functions of the mobility system that we're trying to help with will be affected, including the GI tract as well. So do be cautious when talking to your patients about these medications. So I hope this has helped someone to learn a little bit more about the medications that are used and probably were taken by Dr. or Reverend Jesse Jackson upon his diagnoses, which occurred earlier in his life up until his dying day. So I hope this has helped you. Please like, share, and subscribe, and keep hope alive out there. Take care. Dr. Erica signing off. Bye bye.